Hello, everyone. Thanks for joining us again. So we've been doing sleep management series. In our yesterday's session, we talked about why is sleep important, why we need to have specific number of hours of sleep, and we talked about some of the causes for not getting enough sleep or having problems with sleep. And we were talking about how we are understanding more about using technology later in the day can impact our sleep also. And the mechanism is now better understood that the blue light emitting from the devices inhibits the release of the sleeping hormone called melatonin that our body naturally secretes. And so because of that, we are not feeling sleepy until late and often sleep late, and then our demands of the following day make us wake up early anyway, so that is leading to less hours of sleep. And then we also talked about how if you remember this last slide. Okay, I think I'm going backwards. Yeah. So this slide where we were talking also about, how when we don't sleep well, we are distracted and our ability to, do things and remember things is impacted. And, staying on devices later, especially if you're actually not staying up just for work, but maybe watching a show or often we, after a long day of work, you're like, oh, I never got to have a downtime. And you start to like watch a show or a exciting, thing in the evening that we know is also not a good idea because it can release, dopamine, which is an excitatory kind of chemical, which then makes us more wired. Also, we know that interplay of melatonin with other neurochemicals like cortisol also happens, and so the end result is we are, you know, wired and tired, and so even though we want to sleep, well, we are unable to because our mind is active and body's kind of maybe tired. So how does this information help us with what we are going to discuss today? So, there is this whole concept of sleep hygiene. I would like to open it up and ask the audience if any one of you knows what sleep hygiene means. Have you heard this term before? And if any one of you would like to chime in what your understanding about that is.
So, Dr. Leena, I remember people recommending changing bed sheet every other 15 days, or that is one part, and sleeping on a routine. You were talking about even that body clock.
Yeah.
So I did hear this term before.
Okay. So yeah, so I saw Cliff's comment that he has not heard about that before. Um,
Dr. Lena, see, maintaining a routine is one thing, and maybe, I mean, if you get sleep in a dark place, I mean, having that, and stopping using the screens before at least 1 hour before the sleep, these are the kind of things that you have to do. So,
that's right. Yeah, thank
what
you.
I
Yeah, so thank you for sharing that. Those are some of the things we definitely recommend as part of maintaining sleep hygiene. In fact, the newer recommendation is actually to not be on devices for about 2 hours before your bedtime, not just 1 hour. So let me kind of talk a little bit more about what sleep hygiene is and what all other parts does it have that we should be, implementing. So, the main things that have been found to be very, very effective that come under this concept of sleep hygiene are that you have to go to bed and wake up at the same time every single day, even on weekends. So, let me tell you that this, this whole different tips for following sleep hygiene and maintaining a good quality and quantity of sleep has been very much researched. And what they have done is they had, two groups of people who were participating in one particular study where, you know, one group just followed some of these principles of sleep hygiene, and I'll go over each of those and kind of have a little discussion. And the other group actually was not following any of the sleep hygiene, tips or principles, and they were just, taking some form of sleep aid or sleep medication, whether it was Benadryl or Tylenol PM or, whatever they came across. And so what they found was at the end of 2 weeks, when they, were collecting data in terms of their quality and quantity of sleep, and just overall emotional and physical well-being. So they of course had like questionnaires and they had check-in points they were trying to track within these two groups. At the end of 2 weeks, what they found was the group that followed sleep hygiene had a better data in terms of quality and quantity of sleep, as well as better, parameters on physical and emotional well-being. So this is something we understand that is very simple to do in a way. I mean, you need to have discipline about following some of these things, certainly, but it's kind of at no cost. It's kind of something you can do by yourself in your setup and doesn't really need even a doctor visit or a kind of medication or anything like that. So, I was talking a little bit about physiology of sleep to help you understand why, our circadian rhythm plays a big role in our sleep cycle. And so following that, concept and understanding that our circadian rhythm, this kind of biological clock in our brain that manages our sleep-wake cycle, is very sensitive to change. So if I maintain a good routine of going to bed and waking up at the same time every single day, then it really works like a clock. And I know often, weekends become a question. You feel like I need to sleep in. I'm deprived of sleep during the week because I'm staying up late for work or other reasons. And so it's not an absolute no for you to not sleep in on the weekends, but the general recommendation is you should not be deviating more than an hour, at the most two, from your general wake up time. So if I sleep around 10 p.m. and my time is 6:30, then on weekends, I'm allowed to sleep in till like 7:30, at the most 8 or 8:30. That's the most one should do. It shouldn't be like, oh, I'm going to sleep in and I'm going to wake up at 10 a.m. That will certainly mess up your circadian rhythm. Between the two things, going to bed and waking up at the same time, waking up at the same time is much more important to follow than going to bed time if you have to. And the reason for that is that, even if I had a late night for whatever reason, I slept late, and so I shouldn't be taking that into account. And often we do, because we feel like, oh, I need 8 hours of sleep, and if I slept at midnight instead of 10 o'clock, I'm not going to wake up at 6, I'm going to wake up at 8 to get those 8 hours of sleep. And what we know is that even doing that shifts your circadian rhythm. So the recommendation is that no matter what time you went to bed last night, you still wake up at the same time the next day. And you may be tired, you may be sleep deprived if you actually slept 2 hours later than your usual bedtime, and that's understandable. You'll be tired and you would be, tempted to take a nap maybe, or feel like, I am just not functioning very well. All of that is going to be difficult, but you somehow if you can power through without taking a nap, that's the ideal thing to do. And what they say is that if you're so tired, in fact, the next night, I might start feeling sleepy at 8 instead of 10 because I have, started my day earlier. I didn't get that 8 hours sleep the night before. So I can go to bed earlier. That's a much better thing to do than taking a nap and then pushing your clock again of going to bed later at night. So again, the reason for this is that, if we do take a nap, so ideally, according to sleep hygiene research, one should avoid taking nap. If you are absolutely needing to take a nap because you're so tired, then, they say time it and no longer than 30, at the most 45 minutes of nap. So, those terms of cat nap and power nap, they really need to be short cat naps or like this power nap where you're like resting and getting up. And so I, often, like, if I'm tempted to, like, because I slept late, but I woke up at the regular time and I'm tired during the afternoon time on a weekend and I want to rest up, I will set an alarm for, 30 minutes and put it on snooze. No later than 45 minutes I'm up. And the reason again for this is going back to the physiology of sleep and the two parts of sleep cycle we discussed yesterday. There is a non-REM and an REM sleep cycle. And the cycle usually is at about 90 minutes, right? I was telling you that on an average, in most people, we switch from non-REM, the first part of sleep, to more deeper sleep, REM sleep. And this is usually within 90 minutes, we are usually doing that. And roughly we divide that. Non-REM is about 45 minutes and REM is the 45 minutes, the second half. And so if you're sleeping any more than 45 minutes, you are likely to switch from that non-REM to REM sleep, even it's daytime, even if it's a nap, And the idea is that, you're not needing an REM sleep, like for refreshment and some power and some, just like energizing you and getting you going, you can just be rested just with the non-REM sleep. You don't need to really have that deep sleep where you're starting to dream now, that REM sleep. And if you're doing that, if you're letting yourself take a nap for an hour or two in the afternoon, then it is guaranteed that you're not going to sleep at your regular bedtime that night. And you're going to, switch your cycle where you're now in this routine of sleeping late, waking up at early time because of work schedule or sending your kids to school or whatever compelling reason it is. And then you're feeling that need to take a nap every afternoon. And you're in this cycle then where you're like in this pattern where, you say, oh, I just sleep for 4 to 6 hours at night and then I compensate for rest of the time during, afternoon when everybody's gone and I have my time to myself. And that is not healthy for us because we are really not, following the sleep-wake cycle. And so this is where, a lot of people, I just saw somebody's comment, this happens to me. And I know it's very easy to fall into that routine because that's how our coping happens. But what we understand is that that's the biggest reason why you're not getting good quality and quantity of sleep at night. So the takeaway point is keeping consistency of going to bed and waking up at the same time. Try to keep that generally within an hour to two range with on the weekends, not deviate too much. And then, if you have to still pick between the two times, certainly never change your wake up time. You can switch your bedtime. And then the third thing is that no naps in the afternoon. Ideally, if you absolutely feel necessary to take a nap, time it and set an alarm for no more than 30 to 45 minutes. Okay. So I think that's one of the biggest change I see. It's the biggest variable that I see people follow their sleep starts to really get better. And we spend a lot of time educating everybody about this and they understand why that makes, so much sense now. Then the other things that we know are, things that affect our ability to fall asleep that make us more excited or our brain more excited and avoid us from falling asleep are things like caffeine consumption. So a lot of us, do drink coffee and tea. And so, again, based on research, the recommendation is you should not have any caffeine in any form, and that would include soft drinks or any caffeinated drinks, chocolate, coffee, so anything that has caffeine no later than 3 p.m. in the afternoon. So I know culturally we all are very tuned to like having that chai at 4 or 5 p.m. But based on sleep hygiene research, any consumption of caffeine later than 3 p.m. is also going to impact your ability to fall asleep at night. And this kind of goes to other substances as well. So alcohol and nicotine, if somebody's into smoking, all those things impact our brain chemistry very subtly. And we usually don't understand it in the moment. They might feel like, oh, they are relaxing us and it actually helps me fall asleep. If I don't have that my glass of wine, I'm actually not. You may be falling asleep because in the moment it might be feeling like it's relaxing or sedating you, but it's actually messing up with your brain chemistry long term and messing up with your sleep, besides other things as well. So that's another big thing to remember. The other thing that I'm not necessarily following the order, but I'm going to kind of hop around and tell you things that I definitely talk about. Another big one that we talk about is that if you get to your bed and it's been 30 minutes and you're tossing and turning and you're not able to fall asleep, then the recommendation is you get up and not stay in the bed. And roughly, people kind of keep an eye on the clock, and sometimes people are aware, like I was awake for 2 hours and that's when I fell asleep, or it generally takes me an hour or two before I can shut down. And so if you've done, and I'll talk about sleep promoting activities under which a lot of these things on the slide would be covered. But if you're not able to fall asleep for about 30 minutes after you went to bed, then the advice is you get up and move around. So you can take a little stroll within your house and then sit and do some of the sleep promoting things like reading, listening to calm music. If you are able to do some deep breathing or relaxation exercises, that also helps. And the main point also to remember is that it's advised to not use your bed to read or listen to music or do your work. If you can really bring in that discipline that bed is only for sleeping, and all the other activities like having a relaxing routine before bedtime need to be done on a chair or a couch or whatever. So once I understood this, I started to bring that change in my life too, because we are all very tempted to just go to our bed and read there, and then we drifted to sleep, or we listen to music, or do our breathing or meditation. But it's known fact that our brain is very sensitive to what we call as conditioning to different things around us. So it's almost like if I hit my bed, I need to sleep. It's the only association we want the brain to develop, and nothing else. So if you're working or using other things, activities in on the bed, then that actually confuses your brain and never gives us a simple, straightforward message that bed is, when I hit this, it means I have to sleep. So you want to develop that strong conditioning and association. And so what we say is that you keep a little chair next to your bed, because sometimes you feel like, I'm not going to like sit in my family or living room and wait till I'm drifting to sleep. And then if I start walking and I go to my bedroom, by then I've lost that ability to fall asleep. So we are not saying that you actually even go to a different room to read or do your, relaxing routine. You could keep a small chair or a small, whatever, ottoman or a stool or whatever is comfortable, right next to your bed, do your reading, listening to music, breathing, and relaxation exercises, whatever that is. And as you are feeling like now I'm like ready to drift to sleep, you can quickly shift to your bed and fall asleep. So, doing sleep promoting activities, other sleep promoting activities like taking a warm shower before going to bed. I mean, not necessary, but if some people feel like that's like something they would not mind taking maybe an additional shower if they've already showered in the morning. Having a cup of warm milk. So this is our, culturally, I think our grandparents or parents would tell us to have a cup of warm milk. And I used to always wonder what is about milk that's helpful. So now I understand that milk actually has tryptophan, which is a kind of one of the amino acids, or it's one of the protein molecules in the milk that actually helps releasing melatonin, and it is also a promoting hormone that helps with sleep, and so that's why it is helpful. We've also heard about chamomile tea, which is known to be relaxing. That can be another way. Again, so having non-caffeinated herbal teas, particularly chamomile. I don't know if about others, but chamomile is known to have that relaxation properties. Lavender tea, sometimes if people can, get that, or lavender spray sometimes, or diffuse uh, what's the word I'm looking for? The diffuser with lavender oil can sometimes be also helpful. So some of these natural things that exist around us can promote a sleep promoting atmosphere. And so, yes, sleeping with windows and curtains down to create a dark room. Again, we are trying to facilitate that melatonin release. And so we know sunlight blocks the release of melatonin, and when it gets dark, that's when it's released. So that's why a dark, quiet, comfortable room and cool. So we also know that when our body temperature goes down, that's when we are able to sleep much more easily. So definitely making sure you're not sleeping in a very warm room, or you're not having layers of comforter and blankets on you. So all of those can help you fall asleep. And then we talked about 2 hours before bedtime, no devices because of that blue light emission. Now I certainly get asked this question about oh, but I have to work. I mean, I don't have a choice. So there are blue light filters these days on newer devices that you can adjust. There's also apps that you can install if you have older devices to block the amount of blue light. I mean, we can't completely eliminate it, but we can certainly filter it out and block the amount of blue light coming from the devices. So certainly those things could be helpful. And then, regarding exercise, the recommendation is, yes, we should exercise every day. It's really good for both our physical and emotional well-being. But, really, um, the thing to remember is that you should not exercise closer to your bedtime. So 2 to 3 hours before your anticipated bedtime, you should not be exercising. And so if some of us are like, oh, we work all day and that's the only time I get to exercise, I would encourage you to try to move it as early as you can in the evening, because again, exercise releases excitatory hormones and endorphins that make us more wired and more active, and it can impair our ability to fall asleep. So, here are some more, tips on the sleep hygiene, some of which I already talked about. But, the excessive fatty or heavy meal is also not good for us, because we know that time we want, blood supply for our digestion diverted to, other, not necessarily diverted just for digestion, but we want it to be utilized by other organs that are also helping us relax and fall asleep. And we know heavy meals can often cause regurgitation and GERD or reflux. And a lot of the times people get uncomfortable because of that acid reflux they notice in their throat. So various reasons why we should, try to not eat very closer to bedtime and have a lighter meal. So, some of you had attended my previous series when I was doing a thought management series, and we talked about relaxation exercises, the behavioral techniques under the CBT, and I had covered some of the relaxation exercises such as progressive muscle relaxation, guided imagery. I have covered mindfulness practices, in this past few weeks as well. So we know that, there are various ways to turn the switch off our mind and clear the day and sleep with a clear mind. And so that can be done in different forms and different exercises. And so, if time permits today, I could conduct a short progressive muscle relaxation or a body scan practice. But, these are some things we have covered, so I won't spend too much time. Now, really quick in the last couple minutes, this is just so you know about this. I'm not going to really be able to go into depth of this, but cognitive behavioral therapy that we focused or understood more about during thought management series has been also known to be effective for sleep management. And it's known as cognitive behavioral therapy for insomnia, or CBTI. And as you can see, there is a lot of sleep hygiene is a bigger component of what they do in that therapy. I mean, they come under different subtitles, but majority of the stuff is actually broadly comes under the sleep hygiene. And then there is few other techniques that are available that are added to focus on the thoughts and stuff that might interfere with your sleep. And so there is actually a free app. It's called CBTI Coach. That's available. I think it's free. It's available on all Android and iPhone devices. I don't think it's like something you can just use yourself and kind of get like a lot of guidance. Maybe if you are working with somebody like a counselor or a therapist or your doctor, they might also help you a little bit more about how to use it more effectively. But I think it's a pretty well done app that can allow you to enter some data and track your sleep and monitor some of those components. So takeaway points are sleep is one of the biggest building blocks of our well-being. So we should definitely put in effort to make that, be really good. Sleep hygiene is really a set of simple lifestyle changes that works, and it's not difficult to follow. So putting in effort in that is really a good kind of investment in a way. And then relaxation exercises and meditation, help us to promote and get into, good sleep cycle. So thank you very much. I lost track of time, Poonam. Oh, we are at 8:59. So yeah, so let me know. I could stop sharing and come back to the WebEx. Please let me know how we should proceed. If I am happy to take questions and not do the little exercise, or if people want to go forward and can stay for a few more minutes, I can do the body scan practice.
Yeah, let's do both. Session from Cliff. Do you want me to read?
Yeah, I was asking you yesterday that I'm not sure if you answered earlier because I came in a bit late. There's ginkgo biloba with vinpocetine that you can get from Costco. Does it actually help? Because it does help me, but I'm not sure what actually it does.
Specific mechanism because
Dr. Lena, please do repeat. You were on mute.
Oh, sorry. Okay. Yeah. So Cliff, I don't know about the exact mechanism of ginkgo biloba. But it is almost like I was talking about chamomile tea or lavender. We know some of these herbs and these supplements tend to have some sleep promoting properties. So I've heard of it. If you ask me, is this something I prescribe? I actually don't, because my training has been more around things that we have more research and evidence around. So I can speak more to in terms of natural supplements that I recommend and I have more understanding or knowledge about is melatonin and magnesium. Those are the two that we have some studies that show that they can be effective. And melatonin is very, it's no brainer. We are just boosting the melatonin, which is a normal hormone that's secreted in our system every day. We are just adding another booster to that, and that helps with, um, kind of promoting sleep. And magnesium has some benefit. Again, the real mechanism is not known, but they've certainly noticed that it has helped people also. So nothing against ginkgo, biloba. I'm not, generally if my patients ask me, is it okay for me to continue this supplement? I usually worry about some drug interactions if I'm prescribing them some other medication, but as long as it seems like, there's some evidence and some, belief that this is helpful and you find it helpful and it's primarily just natural, then it's okay to take it. I think there is, from my knowledge, a little bit more evidence around ginkgo biloba around memory improvement than so much for sleep, but maybe it does have that sleep benefit as well.
Is there any side effects of melatonin?
No, so not that we know about. Certainly we don't recommend you take it in excess. The average dose we recommend is actually, the newer studies are talking about low doses, even 1 to 3 milligrams, and even like for some people it could be half of 1 milligram, 500 microgram. But the key is you take it 3 hours to 4 hours before your anticipated bedtime. Often people take sleep medications or whatever medications closer to, like, as you're going to bed, half an hour or 15 minutes before you're going to bed. But melatonin, we want to time it with our natural release in the body, which happens 3 to 4 hours before our bedtime. So we are just boosting those levels and helping you drift to sleep faster. So yeah, as far as we know, I mean, there's no side effects with long-term use, but generally, in my experience, what I really see is that if you follow sleep hygiene really well, if you make that a priority and follow it really with a good discipline, you can use the melatonin in the first few days and weeks while you're getting into a good rhythm and getting your circadian rhythm back into a good kind of routine. But once you get into that, you don't really need to take melatonin after that. The sleep hygiene itself will start to correct it. So that's what generally I see.
Thank you, Dr. Lina.
Dr. Lina, I have a question.
Yes.
Dr. Lina, actually, my wife, right, during the sleep, even in the midnight or something, like, even if I open the door, she wakes up. So does that mean that her sleep pattern, whatever we discussed, right, the REM and all, that is not happening, or it is normal for certain people?
It is absolutely normal for some people to just have more sensitive sleep. So it doesn't quite tell us that she's not really going through like the deeper sleep. It's not how we understand. I think it is just, we know some people are just more aware and sensitive to external noises and things like that. And so I would consider it as an absolutely normal thing and not kind of worry about it.
Okay, yeah, thank you.
Dr. Lina, I have a question related to dream. Is it okay? I ask you now? Yeah.
Yeah.
So actually, I always wonder what happens when we are dreaming. It's like someday I remember my dreams, someday I don't remember, and someday I wake up seeing a dream. So what exactly is happening and how important is it? that during the dream time?
Yeah, so that's a very good question. So honestly, we have some understanding about why we dream and what the significance of that is, but we don't have a great deeper understanding about that. So the understanding is that a lot of the times, you know, stuff that's in our subconscious mind, whether it's experiences from the day or from the past or something you've been maybe thinking about too much, or even sometimes it could be like, oh, I heard about something and I'm like all the information that my brain is processing throughout the day, it can all kind of become like a hodgepodge and come up as a random dream. So sometimes it may mean nothing. Sometimes there is some significance of like, maybe certain, if there are particularly certain themes in your dream that recur over and again, then often there's a significance that it's trying to process something that you are trying to avoid thinking during the day, or you haven't had a closure on a conflict or something. So it's getting really morphed and modified. And you may see it like not as like same people or same thing. It may be even like, I saw this random snake in my sleep, and I saw this and that. It could be coming in a more modified way. It's not quite exactly what it is going on in your life, but sometimes interpreting some of those themes that recur and there's a theme to them may help us understand, oh, that there is something underlying that's not being processed, or there's a little conflict around that you are having. Now, to your question of we remember some dreams and some we don't. And again, it depends on the quality of this dream. Often more scary and more vivid dreams, which some people have, are the ones we remember. And a lot of the other ones we wake up and we feel vaguely we remember. So again, there's no real significance as such, but for vivid dreams and nightmares that wake you up and like freak you out sometimes, those often have some significance, which we try to tap into, especially if you're having a same recurring dream happening over and again, and it's tied to some either traumatic experience or stress or whatnot. Yeah. When I am in stressful state, my stress in my mind does not allow me to sleep, what can I do? Yeah, so that's where the relaxation techniques help. Taking a moment to really clear your mind before you're sleeping. And a simple, I think, exercise is what we call as progressive muscle relaxation. Sometimes we are not in a place to actually just start calming our mind, and we need to calm our body and relax our body first, and then get to a state of calm mind. Sometimes, one could use breathing as a way to really slowly settle, the stress in the mind, and then kind of introspect and introspect what your day was, what were some of the stressful maybe things that you didn't get a chance to process, and kind of cleared that before you get to sleep. So, meditation, breathing exercises, relaxation exercises are the ways to kind of clear or address that stress in your mind. And again, we've been covering this in the last few weeks. It's not just doing it at nighttime, but actually taking a pause throughout the day. And Poonam has been a great advocate of this, which I totally agree is the best way to do it, is taking a minute every hour to take a moment to connect with your inner self, check in your thoughts and feelings, and taking a moment to be the inner being you are, and then coming back and doing your next thing can be also a way to you're like not layering and bottling up things that are all now like exploding at the end of the day when you have gone through the required things of the day. So I think often I say meditation or these relaxation exercises are not really just beneficial just before going to bed, but this like sleep hygiene principles or following some of that discipline around sleep we need to have that discipline also in our lives, because it's kind of taking care of our mind, which we don't pay much attention to. We take a lot of care of our body, but we don't take care of the mind, the hardware that's kind of driving the body and making the body do all those tasks. And so really making a conscious effort to also take care of it by taking pauses and meditating, or being in touch with your inner self, breathing or going for a walk, doing things for yourself, carving out time for that can really be a very good way to actually get through all the stress that accumulates. So
Thank you so much.
Poonam, oh, you're welcome. Poonam, I'm looking at the clock. Are you sure I should do, maybe should I just do a very short one? I don't know how everybody's time is. It's 9:11.
And I think, Dr. Nina, they will enjoy because we talked about meditation and you were mentioning. So it is a good idea in my mind, and I'm absolutely fine to stay longer. If I do see we are having 12 people, so we can continue.
Okay, sounds good.
Hi, Dr. Lena.
Hello.
Hello. My problem is like I fall asleep at the regular time, but in between the night I wake up and 1 or 2 hours I'm awake and then I again fall asleep. So like the morning time I cannot wake up at my regular time. Yeah. So
Yeah.
why this happens? Yeah.
Well, so, I need to get more information, but general reasons could be, often you wake up because of a bio break, you need to go to the, bathroom or something, or sometimes, if you are in this pattern of like whether or not you're actually having to wake up because you have to use the bathroom, but if your sleep cycle is gotten into this pattern that every night at 1 o'clock, I wake up and then I can't fall asleep for like 2 hours and then I sleep at 3 a.m., then that's you need to retrain your circadian rhythm or the biological clock if that's what's happening. But let's say if you're waking up for a break, going to the bathroom, which, you wake up and usually, if you are um, able to come back and drift right back to sleep, I'd say that you make a conscious effort to not start thinking about the next day or think about what had happened yesterday. And that's where it becomes important to clear your mind before going to bed. So if you are working till the last second and then suddenly like now you're so exhausted and you're falling asleep and you haven't quite taken a moment to clear your mind before going to bed, then there is a very good chance that when you wake up in the middle of the night for whatever reason, that those things under in your subconscious mind will resurface and remind you of, oh, this happened, or that's going to be happening tomorrow. Oh no, I didn't send that email. Oh, I forgot to do this. And so um, I think when we get activated with thinking, and depending on what kind of thoughts you are having, that can really get you off of like getting into that sleeping mode, because now your brain is active and you're not able to shut it down. And so what I say is that, of course, uh, kind of clearing and thinking through the day and kind of thinking of important tasks you can do, taking a little time to yourself before going to bed is one way to prevent that. But let's say it still happens, so you try to do the same things that I was telling to do when we try to go to bed. So if you are waking up in the middle of the night and you're back in your bed and you're tossing and turning for a half hour and you're not able to fall asleep, then there's no point staying in bed and tossing and turning further. Wake up and go for a stroll, have a cup of water, sit and read or listen to music. So the idea is to distract your mind from thinking and going into the spiral of thinking and activating yourself more, and finding a way to again calm the mind and distract it from any of those worries or whatever stress. Sometimes I've had patients where they get anxious about being anxious, like I'm worried about you know worrying about not I'm worried about the worry that I'm not going to sleep again, and I'm not going to sleep for 2 more hours, and then I'm going to be tired tomorrow and I'm going to have a horrible day. So sometimes that itself can trigger a lot of anxiety, and those thoughts can spiral you out of control. So the idea is to, not engage in those thoughts and get into that spiral, but it is to, okay, I'm not able to fall asleep. Let me try to do some of the sleep promoting things. And I'm going to fall asleep much faster that way than trying to like fight it in the bed and laying in the bed and tossing and turning. Does that help?
Thank you very much.
Okay, so let's start with our exercise. I invite you all to sit in a comfortable position and close your eyes. If you're not feeling too comfortable to close your eyes, you can also have a downward gaze and stare at a neutral spot in front of you. If possible, sit with your back upright. In the next few minutes, I'm going to guide you through a body scan practice. Let's start with focusing on our breath. Breathing in at the count of 1, 2, 3. Hold the breath. 1, 2, 3. Exhale at the count. Continuing to breathe. Focusing on the deep inhalation. Noticing when you take a breath in, your belly expands. Down. As we are resting in this rhythm of the breath, let's look at the sensations you're noticing in your feet. Maybe it's the feel of your socks if you're wearing socks, or if you're barefoot, notice the coolness of the ground or a footwear you're wearing. Become aware of the spaces in between your toes. Perhaps you're able to feel the sensations in the muscles and the bones around your feet. Slowly allow your breath and attention to move up into your ankles. And notice the sensations in the ankles. Then slowly move up your attention to the lower legs, feeling the curve of the calf muscles and the straightness of your shin bones. When you're ready, relieve your attention into the knees, feeling the muscles and tendons that move and support your knees. Continuing to breathe and notice the sensation in the knees. Notice your mind is wandering. You're getting pulled away by any thoughts or feelings. Notice them and bring your attention back to your knees. the breathing, and now moving your attention into the back of your thighs and the buttocks. Noticing the feelings that you experience in the place where your leg makes contact with the chair, floor, or the couch. Allowing the attention now circle around your outer thigh, over the top of your thighs, across the inner thighs. Perhaps you feel the weight of your clothing and specific sensation in different parts of your thighs. Just notice it. Continuing to breathe. Now let's bring our attention into the part of our pelvis, the area where our legs connect to your body. So the hip joint area. Noticing any stiffness or tightness in those joints. Breathing into those joints and releasing some of that tension. Again, focus your attention on the rising and falling of the breath in your belly, resting in the stillness and quietness between your in-breath and out. Slowly letting the breath and attention move upward into the mid-upper back, noticing the tension in between the shoulder blades. This is the part that often seems kind of sore and tense because of working long hours on computers. Breathing into that area and releasing that tension. And noticing that you are getting distracted by a thought or a feeling, gently and kindly turn back to the instructions I'm giving, acknowledging those thoughts and feelings, telling them you'll return back to them later. Let's continue to move our breath and attention move around the rib cage into the chest. And the movement and sensations of breath in the chest. Slowly drifting up the attention into the shoulders, down along the length of your arms and into your hands. Noticing any sensation of any aches or pains, or tension around your shoulders. Also paying attention and exploring the sensations in the palms and the hands and the back of the hands, fingers and thumbs. Now moving the breath and attention into the neck, feeling along the back of the neck, the sides of the neck, front of the neck, perhaps even feeling movement of breath in the throat. Now allow the breath and attention to move up into your face, feeling the position of your jaw, your lips and facial expression. Perhaps you feel the breath moving in and out of the tip of your nose. Notice the touch of your hair on the forehead. Now let the breath and attention circle along the sides of the head, back of the head, to the top of the head and into the brain. Again, just noting the sensations as you breathe, the attention into your face, head, and brain. Let's final round of attention to fill your entire body from top to bottom, brain, head, face, neck, arms, chest, back, belly, wrists, legs, and feet. Taking a moment to appreciate your body or letting you different day-to-day tasks. Grateful for having a healthy body. Then slowly bringing yourself back to the room you are in. Ready. Open your eyes. I hope that was kind of an experience that you were able to stay with me for the whole thing, I hope.